Hi, I'm Robert Salmon. I'm here with Dave Fornell, editor at Diagnostic and Interventional Cardiology. Thank you for coming by. You get to a lot of trade shows in the course of a year, Dave. You certainly mentioned for many years at RSNA. You come to HIMSS, which is clearly almost like the RSNA for the healthcare IT space. I'm just curious, as you talk to other people exhibiting here at the show, other companies, providers, what do you see as being hot, what's not, what seems to be maybe kind of on the tip of people's tongues at this show?
Well, HIMSS has grown over the last several years by 5,000 to 6,000 people, and I'm sure that's attributable to stage 1, stage 2 meaningful use.
Okay.
The Reinvestment Act with dumping $19 billion plus into the market for electronic medical records.
Small chunk of change, huh?
And government requirements that go along with healthcare reform, requiring electronic medical records and everything going online, with the eventual goal of being able to measure quality rather than just paying a fee for service. And I think everybody's familiar with the electronic medical record, and everybody's looking to the next stage on those implementations, whether it be for specialties, whether it be for remote viewing systems, which is a menu item on stage 2 meaningful use, physician order entry, CPOE, for not just medications, but also for radiology reports, cardiology tests, which would be the next step with all of the specialties going electronic with those orders.
Okay.
Clinical decisions support. It's something I'm looking at specifically because it's going to be a requirement, I would think, in the next few years, and I wouldn't be surprised to see it as a larger part of stage 3 meaningful use. Currently it's on stage 2, but it's kind of vague in its implementation. It just says that you should use it for a certain percentage of your patients, but they leave it open for interpretation. Does that mean that you're using it for helping diagnose a patient? Does that mean that you're helping figure out what steps should be taken, protocols at your hospital with that patient?
Okay.
Or does it mean that you're going to offer 14 different treatment options, maybe for a physician who's not familiar with a certain disease?
Sure. Okay. From your time here, has there been anything that you've seen that maybe hasn't lived up to its expectation, or that's got you kind of wondering if, gee, this particular area of healthcare IT is really going to live up to its promise? Is there anything that's caused you to go, I'm not too sure about that?
With clinical decision support, that's certainly one of those areas, because I was expecting to come to HIMSS to see a lot of stuff that's going to kind of knock my socks off, and a lot of it that I saw was about what I expected to see. And there's no magic bullet for solving a lot of the issues that are out there in the case of clinical decision support. There's so many changes and so many updates with guidelines, with new clinical data coming out of trials, with new devices that are approved by the FDA. It would be very difficult to keep up with that, up to date with that sort of software.
Sure.
With remote viewing systems too, a lot of radiologists might come to a show like this, or cardiologists or any specialists, and I really like to share images that are done from CT scans or ultrasounds. And it's difficult sometimes when you're discussing things with vendors. You have to find out whether it's a viewing system that just allows you to take a look at a static picture, or whether it's a sharing system that lets you download it onto your PACS system at your hospital as a referring physician, so you can pull it in and even use advanced visualization to take a look at the images, or pull out calipers and make measurements, because there's a difference with some of these systems.
Sure. Thanks for coming by. I want to let you get back to the show here. I understand there's about 35,000 people here, of which I believe about 15 to 16 are attendees, and the rest is exhibitors like us. That's a lot of people for a trade show.
Right. This trade show floor has got to be one of the largest I've ever been on. More than 900 vendors. It's vast. By my estimates, I think it's about 3/4 mile long and 200 yards across. It's a pretty good size show.
Big gathering. Thank you, Dave.